Well, now on a story we mentioned earlier in the program, leaked documents indicate that China significantly underreported COVID-19 numbers during the early stages of the outbreak. According to files obtained by CNN, authorities in the Hubei province took weeks to declare new cases.
An unprecedented leak of internal Chinese documents to CNN reveals for the first time what China knew in the opening weeks of the COVID-19 pandemic, but did not tell the world. A whistleblower who said they worked inside the Chinese healthcare system shared the documents with CNN online, which show a chaotic local response from the start.
This lack of transparency sort of also contributed to the crisis.
Seeing information in black and white was very revealing and instructive.
CNN has verified them with half a dozen experts, a European security official, and using complex digital forensic analysis looking at their source code. The documents provide a number of key revelations about the province of Hubei, home to the epicenter city of Wuhan. Firstly, some of the death tolls were off. The worst day in these reports is February the 17th, where these say 196 people who were confirmed cases died. But that day, they only announced 93. China was also circulating internally bigger, more detailed totals for new cases in Hubei. For one day in February, recording internally nearly 6,000 new cases. Some diagnosed by tests, others clinically by doctors, and some suspected because of symptoms and contacts, but all pretty serious. Yet publicly that day, China reported nationwide about 2,500 new confirmed cases. The rest were downplayed in an ongoing tally of suspected cases. That meant patients that doctors had diagnosed as being seriously ill sounded like they were in doubt. They did later improve the criteria.
If China had been more transparent and also more aggressive in responding, clearly they would have had an impact on how much the virus spread in Wuhan, in Hubei, in China, and perhaps to the rest of the world as well.
Strikingly, the documents reveal one possible reason behind the discrepancy in the numbers. A report from early March says it took a staggering 23 days on average from when someone showed COVID-19 symptoms to when they got a confirmed diagnosis. That's 3 weeks to officially catch each case. Perhaps the most remarkable revelation concerns early December, the moment when COVID-19 first emerged in China. Startlingly, these documents reveal there was an enormous spike in influenza cases in Hubei, right when studies have shown the very first known patients were infected with COVID-19. 20 times the number of flu cases compared to the same week the year before. Experts said it could have flooded the hospital system with patients sick from flu-like symptoms, making it harder to spot the first cases of COVID-19. The documents don't link the outbreak to coronavirus's origins directly, but they show flu patients were regularly screened, and many did not have a known flu virus strain, leaving open the possibility they were sick with COVID-19.